I hope that we will be back on the floor to continue the effort to deal with the many unmet needs of veterans. But right now, we have a crisis on our hands, and it's imperative that we deal with that crisis. And to my mind, the essence of the crisis is that we have learned that in many parts of this country, not all parts, but many parts of this country, veterans cannot get the timely care that they need. They cannot walk into a VA and within a reasonable period of time get the treatment that they need. And so this bill, in a significant way, begins to address that important issue. And let me very briefly tell you how it does that. For a start, there are many locations around the country where we need new facilities, we need refurbished facilities, we need expanded facilities. In fact, there are 26 locations in 18 states where that is the case. This legislation would allow the construction of 26 major medical facility leases in 18 states around the country, and I believe that will help us in many parts of the country in providing the quality, timely care that our veterans deserve. Mr. President, in my view, there are areas of the country where we simply do not have the doctors, the nurses, and the other staff that we need to provide the care that our veterans deserve. Many primary care physicians get burned out by working 12, 14 hours a day. They quit. The turnover rate is too high. It is my view that the VA, by and large, and this is echoed by the views of the veterans community themselves in independent studies, that when people get into the VA, the quality of care is good. But I will tell you, if you don't have the primary care physicians, the other physicians, the nurses that you need to treat veterans, they are not going to get the care that they need. This legislation will target $500 million in unobligated balances for the hiring of new VA doctors and nurses. I see that as a significant step forward. Mr. President, one of the great, I think, embarrassments or shocks that all of us feel is that within the military we have seen in recent years horrendous accounts of sexual assault. What this legislation does is say to those women and men who were sexually assaulted in the military that when you get into the VA, there is going to be quality care for your needs.